Hi, my name is Renato Villa. I'll be discussing the case study. Jay, age 17, is on a high school swim team. He presents with sudden onset of right ear pain that worsens at night. He says the pain intensifies when he touches his ear, and he has a feeling of fullness in the ear. On examination, the auditory canal is edematous and erythematous, with a yellow crusting. His temperature is 98.7, no fever, and his tympanic membranes are pearly with landmarks intact. The patient has been prescribed ear drops that family member will be administering for him. So the diagnosis is otitis externa. So what's the diagnostic criteria and clinical presentations? Otitis externa present with a pain on movement of the tragus and a painful erythematous auditory canal with occasional otorrhea, which is air discharge. Hearing is usually unaffected, except pressure of fullness in the ear exists, generating occasional contributive or sensorineural hearing loss. Examination includes the ear canal, the tympanic membrane, the auricle, and cervical nodes. Cerumen or debris blocking the ear canal should be cleared to check tympanic integrity, so using the otoscope. To rule out otitis media, the tympanic membrane must be visualized, normally during pneumatic otoscopy in the patients with otitis externa. If the tympanic membrane is bulging or erythematous, the patient should be worked up for otitis media. So what's the pathophysiology of otitis externa? It is most common infection of outer ear, usually caused by bacteria 99%, and less common of fungus, only 10%. Children, adolescents, and adults are all at risk for developing this infection. The most frequent found microorganisms are Pseudomonas, E. coli, and Staphylococcus aureus. Infection usually is following exposure to moistures, or we call it swimmer's ear. Keeping the ear too clean can also contribute to the developing of otitis externa, since cerumen actually serve as a protective barrier to the underlying skin, and its acidic pH inhibits bacteria and fungal growth. The earliest symptoms are inflammations with swelling and clear drainage, progressing to purulent drainage with obstruction of canal, tenderness and pain with the earlobe, retraction accompany inflammations. So the goal of therapy of this infection. So the treatment are similar to otitis media, which are eradicating the causative organisms, management of pain. This can accomplish by reestablishing an acidic environment in the external auditory canal through direct antimicrobial activity. First-line management of otitis externa is to clear any obstructing debris or excess cerumen from the canal and to check the integrity of the tympanic membrane. And its manifestations of infection have spread beyond the ear canal. Otitis externa treatment consists of topical and otic drops, such as antibiotics and steroids or combination treatment. Mild uncomplicated otitis externa resulting from prolonged exposure to water or humidity is treated topically with an antiseptic such as acetic acid or boric acid applied to the external canal, guarantee the use of an antimicrobial ototopical agent. So what's the teaching plan for the family? Instruct to wash their hands before and after instilling the drops. Patients should be lie with the affected ear facing upward if it is the affected ear. Ototopical should be warmed to the body temperature before installation to avoid dizziness. To warm otic solution, the patient should hold or roll the bottle in the hand 1 to 2 minutes to keep it warm. Open the ear canal gently, your ear back for adults, up, and pulling down on the earlobe when giving medicine to the child. Hold the dropper upside down over your ear and drop the correct number of drops into the ear as prescribed by the doctor. Stay lying or with your head tilted for at least 5 minutes. Use a small piece of cotton to flog the ear and keep the medicine from draining out. Prevention. Prevention is the key and plays a significant role in reducing the overall burden of illness. Office visit, antibiotics expenditures, severity of illness. Vaccination programs has been shown to have the favorable outcome on decreasing the overall incidence of these infections, namely those caused by Staphylococcus pneumonia, influenza, and Haemophilus influenzae. Thank you.